If you've recently been diagnosed with prediabetes, or you know someone who has and you just want a little bit more information about what that means, if that's you, or if you're just curious, today's video is going to be about 5 things to remember about prediabetes. If you're a patient of mine and I sent you to this video, then hopefully this fills in some of the gaps that we couldn't quite cover during our visit or during our messaging. At its simplest, prediabetes is just that stage before diabetes. Most of us here in the States use a test called the hemoglobin A1C. This is a test that basically gives us an average blood sugar over a 3-month period. If you want a little bit more detail, what it's measuring is how much sugar or how much glycosylation is on the red blood cells. And since the red blood cells live for about 120 days, that's why this is an average of a 3-month period. So first off, the definition. An A1C of 5.6 or lower is considered normal. 5.7 to 6.4% is considered pre-diabetes, and 6.5% or higher is considered to be diabetes. Now this video isn't going to discuss diabetes too much, as this is talking about that pre-diabetes stage just before. But basically, diabetes is a sugar regulation problem. And again, as this video is about pre-diabetes, we're going to be focusing on the range where your hemoglobin A1C is between 5.7% and 6.4%. So with that said, let's get started with the 5 things to remember for prediabetes. So one thing I'll say is I will apologize if there's a little bit of shaking in this video. I forgot my tripod in my car and my wife took it. So I have the camera set up on the table here. And so if it kind of shakes, that's because I'm not used to having it there. And forgive the hat. I was lying down trying to get the 1-year-old to go to sleep, and then my hair is all sticking up, so I just threw the hat on. I guess I could have brushed my hair, but that's another video. Anyways, the first thing to remember for prediabetes. Number 1, it's asymptomatic. Most of the time when people get diagnosed with prediabetes, it's because they got tested in a regular screening test. So this might have been a regular metabolic panel that showed a glucose, and they probably would have been fasting when they did the test, or their doctor might have ordered a hemoglobin A1C. And again, because it's a screening test, I'm going to assume that you didn't have any symptoms suggesting it. Sure, you might have risk factors for diabetes, but often primary care doctors or primary care providers will be checking an A1C to screen for diabetes. Point is, usually people don't know that they're in this pre-diabetic range when they find out. Sometimes that can be a little frustrating because you feel otherwise normal and then you're told you are pre-diabetic. But the reason I want to bring up that it's asymptomatic is that just because you're feeling fine doesn't mean that there's nothing wrong. This is an excellent time, if there is an excellent time, to catch something in that pre-disease stage. So the second thing about my daughter just walked in behind the camera and she's laughing at me recording here. Shh. All right. So number 2, one of the things to remember with prediabetes is that it represents a risk of progression to diabetes. I don't like to diagnose things for the sake of diagnosing. The utility of diagnosing someone with prediabetes is to give them a heads up, I guess, or to indicate that they do have a risk and to be careful with what you do afterwards. What's next? So you've been told you're pre-diabetic. Is there anything that you should do? Is there anything you should keep in mind? What do you do with this knowledge that you're at a high risk of progressing to diabetes? So the next step is moving or shifting our focus to prevention of diabetes. To do this, we target lifestyle modifications that have been proven to delay progression to diabetes, preserve the pancreas' ability to produce insulin to help control blood sugars, and finally, to prevent or delay complications that are associated with diabetes. So number 3, or the third thing to remember when you've been told you have prediabetes, is to optimize dietary intake. Now, if this doesn't apply to you, then great. If you've already optimized your diet as much as you can, awesome job. But most of us have room for improvement in this area. But if this is an area for improvement, then cutting out those sugary foods and drinks will help a lot. You know, those donuts at work, the desserts at the potluck, or those sodas that you drink. Cutting those out, and it doesn't have to be never. Maybe once in a while is okay, but trying to eliminate these things will definitely help in the control of your sugars. Obviously, the impact of reducing or changing your diet will depend on what your baseline intake level already is. But for those who can have a significant reduction, the payoff will be worth it. Second, limit your intake of simple carbohydrates like rice, bread, pasta, tortillas. And I know this is hard. I'm a huge carb lover. Most ethnicities have carbohydrates as a large portion of their meals. I as an Asian American, love rice, and so that's the hard part for me. And my daughter is standing over there waving that she loves rice too. But small adjustments over time can make big improvements. And one piece of advice I commonly give to my patients is that they should use a dietary tracker or a food log. I usually recommend that they keep a log for at least 1 week and be very strict. There's a few different ones on the App Store or the Google Play Store where you can buy an app and just enter in these food items or drinks that you eat or intake, and then it'll give you a total calorie intake for that week. Now, odds are you'll probably see on the app that you're eating more than you thought you had. Number 4, physical activity and a healthy weight. Your body needs fuel. The muscles that move and carry you, they need fuel too. And sugar is one of those big sources of fuel. Regular exercise and maintaining a healthy weight, 2 separate things, are going to be important to help control your sugar. If you're not a regular exerciser, consider starting with 150 minutes of moderate activity a week. After 150 minutes, it's probably good to start increasing the weekly amount. Of course, consult your doctor or your provider before starting any major exercise program. And number 5, smoking. I know everyone has heard that smoking isn't good for you, but several studies have raised the possibility that smoking actually is a risk factor for diabetes. If you're currently smoking, make sure to discuss this with your doctor. I can't say I know from personal experience, but a lot of patients have told me that smoking was one of the hardest things to quit for them. If you need help and you're struggling in this area, reach out to your doctor. There are programs and medications that are available. Lifestyle changes are hard, and making drastic changes are even harder. So one piece of advice I always give is to start slow and make small changes at a time and keep moving forward. Don't be disappointed or don't be discouraged if you slip up or you mess up. Just get back up and try again. So hopefully these 5 things were helpful for you today. And if you're here because you're a patient of mine and I sent you to this video, hopefully this filled in the gaps that I didn't get a chance to talk about. And if not, we can definitely talk about it more at your next appointment, or you can send a quick question on your secure portal. Thanks again for watching the video. Hope you stay safe and stay healthy, and see you in the next video.